Have you ever caught yourself saying, "Well, I'm getting older, so I guess this is normal"? Maybe you've noticed you're forgetting names more often. You feel exhausted even after sleeping. You struggle to get up from a chair. You don't have the energy you used to. And perhaps you've accepted these changes because everyone around you says the same thing. That's just aging. But what if some of the things we blame on aging aren't actually caused by age? What if they're warning signs? What if your body is trying to tell you something and you've been taught to ignore it? Today, we're going to uncover several changes that millions of adults over 50 assume are normal, but in many cases they aren't, because growing older is inevitable. Declining unnecessarily is not. And the sooner you recognize the difference, the more power you have to protect your health, independence, and quality of life. Let's begin. Constant fatigue is not just getting older. Many people over 50 wake up tired. They feel drained throughout the day. Simple tasks suddenly feel exhausting. And they assume, "I'm not young anymore." But persistent fatigue is not something you should simply accept. It can be linked to poor sleep quality, sleep apnea, vitamin B12 deficiency, low iron levels, thyroid problems, diabetes, heart disease, depression. Your body is designed to produce energy. Yes, aging may slightly reduce stamina, but feeling exhausted every day is different. If you constantly need naps or feel tired despite adequate sleep, don't dismiss it. Listen to your body, because chronic fatigue is often a symptom, not a normal consequence of age. Losing strength rapidly isn't normal. Many adults think weakness is unavoidable. They stop carrying groceries. They avoid stairs. They need help getting up from the couch. And eventually they say, "I'm just old." But severe muscle loss isn't something you should ignore. Starting around age 30, muscle mass naturally declines. However, inactivity accelerates that loss dramatically. A condition called sarcopenia can cause loss of strength, balance problems, falls, reduced independence. The good news? Muscles respond to exercise at any age. Research shows people in their 70s, 80s, and even 90s can regain strength through resistance training. Growing older doesn't mean becoming weak. Movement is medicine, and strength is something you can continue building throughout life. Memory problems should never be automatically dismissed. Misplacing your keys occasionally? Forgetting a word from time to time? That's common. But increasing forgetfulness that interferes with daily life deserves attention. Many people assume memory decline is unavoidable, yet severe cognitive changes can be linked to vitamin deficiencies, sleep disorders, medication side effects, thyroid disease, depression, hearing loss, early dementia. Interestingly, untreated hearing loss has been associated with increased cognitive decline. When the brain struggles to process sound, it uses more energy and receives less stimulation. That's why taking memory concerns seriously matters. Don't simply say, "It's old age." Ask questions. Seek answers. Because some causes are treatable, and early intervention can make a tremendous difference. Falling frequently is a warning sign. Many older adults joke about becoming clumsy, but repeated falls are never something to laugh off. Falls are one of the leading causes of injury among older adults, and often they happen because of poor balance, muscle weakness, vision problems, medication interactions, low blood pressure, neurological disorders. One fall can change everything. A fractured hip can lead to months of reduced mobility and loss of independence. That's why prevention matters. Balance exercises, strength training, vision checks, home safety improvements, and reviewing medications with your doctor. Falling is common, but common doesn't mean normal. Chronic pain is not something you must endure. Many people wake up hurting every day. Aching knees, back pain, stiff joints. And they say, "This is what happens when you get older." Not necessarily. Pain is your body's signal that something needs attention. Conditions like arthritis, inflammation, poor posture, weak muscles, herniated discs, osteoporosis can often be managed. Unfortunately, many adults simply suffer in silence. because they believe pain is inevitable. But pain should never become your identity. Treatments, physical therapy, exercise, weight management, and lifestyle changes can dramatically improve quality of life. You deserve comfort, not endless suffering. Depression is not a normal part of aging. Feeling lonely occasionally is human, but persistent sadness, hopelessness, or loss of interest in life isn't something to dismiss. Older adults are often told, "You have a lot to be grateful for. Just stay positive." But depression is a real medical condition, and it often goes undiagnosed in people over 50. Symptoms may include fatigue, changes in appetite, difficulty sleeping, lack of motivation, withdrawal from others, persistent sadness. Depression is treatable through therapy, support, lifestyle changes, medication when necessary. Growing older should not mean giving up joy. Mental health matters at every age. Shortness of breath should never be ignored. Do you find yourself becoming breathless while walking short distances, climbing stairs, doing simple chores? Many people think, "My lungs are just old." But unexplained shortness of breath can signal heart disease, lung disease, anemia, poor fitness, fluid retention, high blood pressure. Breathing should not become a struggle. The earlier these conditions are identified, the better the outcomes. Never assume difficulty breathing is simply part of aging. Your lungs and heart deserve attention. Poor sleep isn't something you must accept. Many adults over 50 say, "I only sleep 4 or 5 hours now. That's normal at my age." But sleep remains essential throughout life. Consistently poor sleep increases the risk of memory problems, depression, heart disease, diabetes, weight gain, weakened immunity. Sleep problems may stem from sleep apnea, stress, medication side effects, chronic pain, anxiety. Healthy sleep isn't a luxury. It's one of the pillars of longevity. Never underestimate its importance. Incontinence is common but treatable. Millions of adults experience bladder leaks, and many suffer in silence because they feel embarrassed. They think, after 50, this is just how life is. But urinary incontinence often has treatable causes, including weak pelvic floor muscles, certain medications, urinary tract infections, diabetes, prostate issues. Simple interventions can make a huge difference. Pelvic floor exercises, physical therapy, lifestyle changes, medical treatment. You don't have to silently accept discomfort. Losing interest in life is not normal aging. Perhaps the most dangerous myth is this: life naturally gets smaller as you age. So people stop learning, stop traveling, stop making friends, stop dreaming. They tell themselves, "My best years are behind me." But that's a story, not a fact. Many people discover new passions after 50, after 60, after 70, even after 80. Purpose doesn't retire. Curiosity doesn't expire. And joy has no age limit. Growing older doesn't mean becoming less alive. It means having the opportunity to live differently and often more meaningfully. What actually is normal aging? Let's be clear. Normal aging does include some changes. You may need more recovery time, notice slight decreases in muscle mass, require reading glasses, experience slower reaction times, have occasional forgetfulness, but severe fatigue, frequent falls, persistent pain, shortness of breath, depression, rapid weakness, or significant memory problems. These deserve attention, because common and normal are not the same thing. Millions of people experience these issues, but that doesn't mean they're inevitable. What you can do starting today. Here are 6 powerful habits that support healthy aging. 1. Keep moving every day. Walking, stretching, and strength training preserve independence. 2. Prioritize protein. Muscles need adequate nutrition to stay strong. 3. Protect your sleep. Quality sleep supports the brain, heart, and immune system. 4. Stay socially connected. Relationships are powerful medicine. 5. Don't ignore symptoms. Early detection saves lives. 6. Keep learning and finding purpose. The brain thrives on curiosity and meaning. Small actions repeated consistently create extraordinary results. If there's one message to remember today, it's this: getting older is natural. Suffering unnecessarily is not. Too many people spend years believing their symptoms are simply old age, and because of that, they delay seeking help. They give up hope. They shrink their world. But healthy aging isn't about pretending you're 25 again. It's about protecting the body and mind you have today. Because 50, 60, 70, and beyond can still be years filled with strength, curiosity, connection, and purpose. So don't assume, don't ignore, and don't let the phrase, "that's just aging," stop you from asking questions. Because sometimes the symptoms people call normal aging aren't normal at all.
Before we conclude, a quick reminder. The information shared in this video is for educational and informational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this channel. Your health is your most valuable asset. Treat it with the professional care it deserves.